Can you please share one or two brief stories of complex or profound cases that you helped through upper cervical care?
Well, yes. I want to share a few cases with you that have benefited from specific upper cervical chiropractic care. One gentleman by the name of Mark came into our clinic, and he had been to several other chiropractors in the past and thought that he might be able to get some relief from some neck and back pain and some numbness and tingling in his arms and legs. But he also came in with seizures, and he had been having seizures for a few years, could not take the medications because he couldn't work. And what I found out later is that he also had a lot of problems with anxiety and with really just controlling his temper. He was always on edge, he was always anxious, and could snap very easily. This was affecting his work, his home life. It was affecting his entire life. And so when we started working with him, he had had seizures on a very regular basis, but after his first correction, he no longer had seizures. But after several years, we had been having to adjust him every 2 to 3 weeks. With the expansion in our services, the more specificity of the work that we did, we are now able to see him at about a 3 to 5 month interval and keep him in much better condition. This gentleman also had had fusion surgery to his neck area, and so we're able to safely work with those conditions and problems. I'd like to share another case with you of a young lady that came into our clinic, and she was also post-surgical. She had had a fusion in her neck area. She was hoarse. She was having horrible migraine headaches, and she moved into the area. A chiropractor from her hometown in Michigan and referred her down to our clinic. But she was expecting to get the regular manipulative type chiropractic adjustments, which helped her. When we introduced upper cervical chiropractic care, she was sort of resistant to that. The fact that we used a percussion instrument, that she could not feel the adjustment happen. She came into our clinic that one day that I recall, and she was wearing sunglasses even inside, and she could not process, she could not think. Her husband was helping her, but after the adjustment, even before she left, sunglasses wore off, smile was there, and she was starting to recover from the migraine headaches. She went on to doing very well, and her migraine headaches dropped from being almost a daily thing to her rarely, if ever, having another migraine headache. And again, we did that all with her having a fusion surgery. Even the hoarseness problem that she experienced did somewhat improve.
When someone experiences an alignment of the craniocervical junction, what are some of the mechanisms behind the healing?
Well, in chiropractic, we talk about the importance of letting the body function as it was intended. So when we approach these sort of conditions, our goal is to restore the normal alignment, the normal balance, and restore the body's ability to heal itself. The way that is done in our practice is because of this type of care we take, the sort of precision of the x-rays and the evaluation. The extent to that we do that allows for the adjustment to work much more effectively, much more quickly, and in the long run to be able to hold and actually correct these problems more consistently and more completely. In other words, actually be able to correct these problems on a more permanent basis.